Welcome everyone to Health Awareness Campaign. My name is Raj Kiran. I'm a pediatrician and your host for this program. Today we are going to talk about child development. And as we all know, it's a very important aspect of life for a child. As we know, 90% of the child development, particularly the brain development, happen in the first 2 years of age. So it is very important child should have a very emotional, supportive environment in the family and should have a maximum exposure to the language what we speak and should have a very socially supportive environment. Every child develops at a different pace, at a different rate. We should not compare one child's development with another child. But yes, we do expect certain milestone a child should achieve at certain age. To discuss all these things about the child development, we have team of specialists with us. We have Pauline, who is a team leader at Wyndham Council. We have pediatric dietitian Jody McGrath, and we have a pediatric psychologist, Dr. Malini Singh. Welcome all of you.
Thank you.
Thank you.
And thank you for sparing your time and helping our community to create a lot of awareness about health issue. In the child development, I think the first important part is, it comes in my mind in looking at your green book. So it looks like to me it's a Bible for children and the child growth, and where everything is recorded. And I can see it's with you and with some purpose. So would you like to tell us a little bit about how it is important, that green book for a child?
It is a very important book for a child. Every baby that's born in Victoria is actually given a green book. And for children who may have come from overseas, who are under 3.5 years of age, they can actually access a green book through the Maternal and Child Health Service. So inside the green book, this contains your child's journey from birth through till 4 years of age. And in it, there's lots of exciting things for families to have a look at. There's the growth charts that will actually plot the growth and development of the child as they go through their 10 key ages and stage visits with the Maternal and Child Health Service. There's immunisations and a record's kept in here of those that are really important now. The birth details of the child are also freely available and written down in here for them. And then we go on to the key age and stage visits that families have with the Maternal and Child Health Service in Victoria. It's a free service for all families who live in Victoria, and there are 10 key age and stage developmental ages and stages that we consider really important for families to come and have their child have a little developmental assessment done of their child. Prior to coming to the visit, we would ask the families to actually read the book and have a look, so that in each one of the key age and stage visits, such as the 4-week visit here today, it will tell you some things that your baby would be doing around 4 weeks of age. And that's just as they're developing. Little things like grasping your fingers for a 4-week-old baby. That's something that we expect your little baby to be doing roughly around the 4 week of age. If it also gives you some tips that you might like to talk to your nurse about if you've got some concerns about your baby at all. So this book really is a great book for your little child to have, and it's also a great reference when you're going to the paediatrician, because we encourage you to take the book with you when you go to the GP or the paediatrician, the dietitian or the psychologist, really, because it is an invaluable record.
Thank you. I think I really like the word you use, journey, and it is really a documentation of child's journey through the early crucial development years, and everything is recorded. And you mentioned that there is a certain expectation that child needs to achieve that milestone during that age, and it gives a very pictorial, visual view to you, to us, and to the family, how the child is doing in the different stages. And if a child is not doing well within the normal norms, yes, this is the time where the child needs to be referred to GP or to pediatricians for further assessment. It still might be nothing, but it is good to have advice from a specialist at that time to make sure your child is growing within the normal norms. Without further adding to the growth of the child, the next stage after delivery comes is when all parents look into when my child will start eating solid, which is a big a further step in the development of the child and exciting for the family, but it can be very challenging for the family too. So what age do you think as a dietitian the child should be started on solid, and what solid a family should start?
Yeah, great question, because this is something that's actually changed a lot in recent years. So previously it was suggested to introduce solids around the age of 6 months. Newer research is suggesting that we don't actually need to wait that long, but we can introduce solids around the 4 to 6 months of age. This, of course, is very dependent on the baby and when the baby is ready for their first foods. So babies will often display signs of readiness to be introduced to solids. This might be showing a keen interest in food when they see mum or dad or their siblings eating. They might be reaching out towards food. They might be reaching out towards, forks and spoons and wanting to feed themselves. So the best things to introduce babies to first is iron-rich food, because iron's a nutrient that is required in larger amounts once the baby reaches 6 months of age. And this can be things like iron-fortified cereals, lean meats, fresh fruits and vegetables. Another concern that parents often have is allergies and whether or not to introduce high allergy foods into the baby's diet. So again, this is something that's recently been upgraded in terms of evidence, where we suggest not to delay introducing these sorts of foods, so things like peanuts or eggs. Even if the siblings or the parents themselves have an allergy, it is best to introduce these foods from an early age in the hope that the baby won't develop any food allergies.
Yeah, thank you, Pauline. As you heard, introduction of solid is an important aspect in a child development, and the more recent trend is changing, and we advise that the solid should be commenced in more early age, and that's around somewhere between 4 to 6 months. It's important to look into the certain signs the child might be indicating that he is ready for solid. Some children might have that sign delayed, maybe at 6 months, and some kids can show these signs at 4 months of age. So can I ask you one thing? How parents will know that my child is ready for the solid?
So, bit as I was mentioning before, but it's that readiness that they're showing. So that keen interest in food. They might even be displaying some type of, they might be chewing, or they'll be showing, they might be poking their tongue out when they're around food, and that's usually a sign to say that yes, the baby is interested in food. If they're not showing those signs, then they might be one of those babies that you won't introduce solids until around the age of 6 months.
Yeah, and sometimes it could also be think that when you are eating and the child is looking at the food with very much of interest and try to reach the food, is that could be a sign of?
Definitely, yeah.
And sometimes putting in a hand or finger fist in the mouth, that could be a sign that the child might be ready for.
Mimicking those
chewing movements.
Yeah, mimicking those behaviours that the parents are doing while they're eating. If the baby's doing that as well, that's quite a good sign that they're very interested in eating food.
Yep. Thank you. So it's very important to look into what are the signs your child is showing, whether your child is ready for the solid or not. So it's important to start solid in early stages rather than late. There is a changing concept that it reduces the chances of allergies in children, and particularly in children those who have severe gastroesophageal reflux or underlying in a family history of allergy. We suggest to start an early solid. It is based on the family history. There's no point of avoiding food in your child. Yes, your child might be slightly at more risk than the general public to have the allergy, but there's no point of going for any testing till your child has been tried on that food. Dr. Malani, being a psychologist, it must be an amazing experience. Seeing a different emotional, psychological aspect of child. and the family, the impact of the diagnosis on the parents. So just extending talk to what we had with Pauline, that the child when screened can have you expect that the child must be achieving a certain milestone at certain age, and when the child is not achieving that milestone, we label them or we call them, or parent understand, and sometimes Dr. Google labeled them as a developmental delay. So this could have a very emotional impact on the family. So can you tell us a little bit about the journey the parents, in your experience, might go through if this diagnosis is revealed to them?
That's a really important and valuable question, Dr. Raj. In my opinion, I feel it's a huge emotional journey for any parent to be faced with a diagnosis of their child, the most precious being in your life. And when you come from a culturally different background, it's even more confusing. The terminology is confusing, the system is confusing. So it's really important for the parents to understand their own emotions in regard to the turmoil it creates, to go through the emotions of denial, grief, sometimes blame, what could I have done differently, and acceptance. So we can work together in a very family-centered model to help the child as best as we can as the group.
Very interesting. I think just, Malini, you're right. I mean, having a diagnosis can have impact, not only the child, and it affects the whole family. And particularly in a family, parents, those are a bit sensitive. And those who also anxious and they read a lot on Dr. Google, that create a lot of anxiety too. And it can create a lot of trouble, emotional trouble in coping with this diagnosis and their capacity to help the child. Of course, initial phase is always the phase of denial for any diagnosis, not accepting how can it happen to me, and why it with me is the second stage, and where you start why me, why my child, the blame, and then did I do anything wrong? I'm a bad parent. Didn't rear my child well? Or did I do anything wrong during my pregnancy? Or sometime I had just one glass of wine. Probably that has caused my child developmental delay. Or I had one smoke during pregnancy. Maybe that caused the problem. Why did I do it? So parents go through all this emotional turmoil and the imbalance of blame and denial stage. So that's where I think it's important for parents to, if they're going through that stage, to of course meet you or any psychologist and to try to understand the diagnosis. Of course, going to the more clinical aspect, need to see a pediatrician or your general practitioner, and so you can understand the diagnosis better. Important thing is to understand that it's not the end of the world. There could be solution for your diagnosis. There could be a lot of help available to help your child to reach to the normal norms or to the nearly normal development in due course of time. Of course, it is a long journey for a child and for the family with a developmental delay, but it takes its time. Thank you, Malini. Thank you. Hey friends, we'll take a short break. Please keep watching and we'll be back soon. Thank you. Welcome back to Health Awareness Campaign, and I'm Raj Kiran, your host, and with me we have a team of specialists who is working with child development. So we'll continue our talk further. During the child development phase, we do see fussy eating. It's a very common thing, and sometimes kids test our boundaries. And by their own behavior. Though cultural aspect definitely puts in a lot of pressure on fuzzy eating habits. It's a very common thing I see in my practice every day. 2 or 3 patients every day I see, my child doesn't eat, so what should I do? So as a dietitian, I would like to know from you, why kids are fussy eater, and what advice would you like to give it to the parents, how they can tackle it well?
Yeah, great question. And it's something that I think a lot of parents feel they experience, but they're definitely not alone, because most babies and children will go through the fussy eating stage. And I think the most important thing to remember is that parents need to be very patient, and they need to be persistent as well. Sometimes it can take up to 10 tries before a child will actually accept a new food. One good suggestion is to offer new foods to the child with foods that they have previously liked and that they do enjoy to eat. So it makes it a bit more familiar and easy for them to enjoy. Parents also have a really important role in being positive role models. So if you're going to ask your child to be eating a new food, it's important that you're also eating that food as well as a parent. Some parents also worry that their child simply isn't eating enough. Maybe not that they're a fussy eater, but they're just eating smaller amounts. One thing to keep in mind is that children are very good at identifying their hunger signals, and they're also very good at regulating their appetite. So unlike adults who could happily sit in front of the TV and finish off a whole meal and still feel hungry at the end, children typically don't do this. So they will eat as much as they need, and they will generally stop when they're full. As long as the child is growing and developing as normal, then it's generally nothing to worry about if the children are, eating a little bit less than what you'd like. Another good option is to not sort of force your child to be eating new foods. It's very good to offer them a wide range of foods, so fresh fruits and vegetables, lean meats and cereals, and not to give in to children when they might be throwing tantrums, or they might be demanding sweet foods or salty foods, or perhaps all they want to have is milk, because often milk can fill them up, and then they're not likely to eat their proper meal.
Yeah. Thank you. And Pauline, can you just tell us, you are probably also seeing the same problem in your clinical practice, and when kids come to you for screening, and considering your green book, like where we have the growth charts, the height and the weight, and putting the fussy eating habits together, what advice do you give to parents at that time?
Yeah, and we do see a lot of families who are concerned about their little one not eating enough. Generally what we would do is, in the maternal and child health clinic, they would do a weight and a measure and a height, and then we would plot them on a graph, and it's found in your book here, and you can follow it from the baby's birth right all the way through, and all we would ask is that the little baby follows the curve of the graph as they develop through their lifetime, really, and generally these children are following that graph. If they are, then we would be reassuring the family again to say that it's quite common that children do transition through some fussy eating times, particularly between, say, the 18-month to 2.5-year time. They can be quite difficult sometimes. Again, we'd be reiterating what our dietitian here has suggested, that you persist, really, and just keep offering them good, healthy food. Certainly we were looking at a bit of a history of what the child has eaten over the past 24 hours, just to see that we can identify anything that perhaps is a warning to us, that, for example, that the child has drank 2 litres of milk in the last 24 hours and doesn't feel like eating food. And we know that milk fills you up. It's a food, so you're not going to get hungry if you're drinking a lot of milk. But generally it's about reassuring families, giving them some information and some appropriate websites. Raising Children's is a fantastic website to put families onto for some further advice, and it's just really reassuring families that this phase will typically pass.
Very valuable and very valuable information. Thank you. Marini, considering this fussy eating habit, like the psychological, emotional impact, it can be very challenging for parents to feed a child who is fussy, and And of course, particularly in current life, everybody is so busy. Parents have so much less time. And fussy eating habit means you have to feed, spending so much of time for your child. It brings a lot of anxiety to the parents and a lot of pressure to the parents. So as a psychologist, what advice do you think you have for this family, how they should cope with this whole situation?
I do see a lot of these issues in our pediatric practice, so it's quite relevant to talk about it. From what I've seen, I think when parents are anxious, and you can become quite anxious around meal times, anticipating that your child isn't going to eat now, it can be something that can transfer to the children quite easily. They will pick up on parental anxiety and react to it. So it's so important to manage our own anxiety as parents when you have a child with fussy eating. And as Pauline pointed out, it's so important to keep on top of the growth charts and to see how a child is progressing. So if you are worried, but nutritionally and from a growth perspective, your child is really doing well, then I feel it's a good way to calm our anxiety down as parents from overseas backgrounds, and with the suggestions that Jody was talking about. One of the things I also find is from a behavior perspective, children often can use food as a sort of control. So it can be a great way to control mom and dad's attention, and it's important not to reinforce that behavior, but to encourage and praise good eating habits and to try to work with the child at their level to promote a healthy eating pattern.
Thank you, Malini. So friends, you're seeing fussy eating habit is not a uncommon thing, it's a very common thing. So if your child is a fussy eater, don't worry, you're not the only one. Your child is not the only one. There are many more kids in the family. So important thing at this stage is to see, as Pauline and Jody has mentioned, look into the growth of the child. If when you go to the Veterinary Health Center, the child is meeting the milestones and meeting the growing according to the curve, what has he's been, always been. If it has been 50th centile and the child weight and height is falling the same centile, there is nothing to worry. So it means child might be fussy or maybe picky, might not be eating vegetable according to the amount you want or according to the number of vegetable you want, but child is taking his or her share and child is taking nutritionally good good diet and child is growing well. So at this stage, just definitely you don't need to worry about. One thing I always say, as Jody has also mentioned, important thing is to develop the good eating habit in the family culture itself. That definitely reduce the fussiness in the family, the what we call is a dining table etiquettes. Eating dinner together as a family, child should be offered the same food what you are eating. Limited time, 20 minutes, 30 minutes to the child to eat. Involve the child in cooking or setting up the dining table. That helps in increasing the interest of the child. Offering the fussy food on the dining table every day. Many times, as Jody mentions, maybe you might have to give the food 10 times before child will accept it. These are the few habits we need to develop first in ourselves, then definitely in the child. That will definitely help in fussiness. Uncommonly or rarely, fussy eating habit can be because of underlying medical conditions, which as a pediatrician definitely I would like to mention. Some of the children with underlying autism, they can have fussy eating habit. Some kids with underlying medical issues like ADHD or ADHD medications can be fussy eater because of their medication impact. Some kids can be fussy because of the underlying food allergies. Some kid might be fussy eater, as Jody mentioned, that they are having a 2 liter of milk every day. So reducing the amount of milk, juice, fuzzy food will definitely help. Majority of the time, I will again mention fuzzy eating habit is a behavioral issues where child is trying to test his boundaries and your boundaries. Very rarely it can be an underlying medical problem where you need to consult. If you can't handle the fuzzy eating habit yourself, definitely you can approach to your medical practitioner or your pediatrician close by. Help is needed at different stages of life. It might start with a veterinary child health center, to GP, to pediatrician, from psychologist to a dietitian. So don't hesitate if there is a need of help. Try to tackle these issues early. We were going through the green book issues. I'm just coming back to your green book, saga again. As you mentioned in the green book, there is a different age you would like to see a child, and the different milestones a child needs to achieve. So can you mention few of the key milestones which parents should, just roughly, parents should have idea, like suppose what a 6-month-old child we expect, what a 12-month-old child mom should expect, and they should, my child is not doing this and I need to come to you or to me as a pediatrician or to GP to look into the further investigations point of view. So can you just mention what are the key screening points or tests we do according to this green book?
Okay, yeah. From 4 months of age right through until 3.5, we do what we call a PEDS evaluation, that we ask the families to fill in a questionnaire that's actually in the book, just to see how they think their child is travelling, to see if they've got any concerns with how their child's developing, if they've got any concerns with any speech that their child may or may not have, if they've got any concerns with the movement of their arms or of their legs. There's about 8 questions there that they ask, and mum and dad can just tick yes or no and write in there what their concerns are. And similarly at the consultation, the nurse will also look at the child as the child plays in the room, and she may form an opinion that maybe she's got some concerns about that child as well. So the two of them have a conversation about the child, and because there's been some identification of some of the key issues, such as speech, perhaps being a bit delayed, it might be that the 12-month-old is making no noise. The nurse will then suggest a Brugance screen, which is a secondary screening tool, and that actually helps to identify where in the trajectory of development your child is actually sitting. And if it's below a certain level, then what the nurse will do is she'll fill the forms in and give the parents a copy of the scoring of the system of the Brugance, and she will suggest that the mother needs to go, or father needs to go to the GP and get a referral to the paediatrician, because the nurses aren't diagnosing, but she's recognised that there's something there, or the mother may have recognised that there's something there that just needs more follow-up, and it's certainly to the GP, and requesting a referral straight to the paediatrician would be fabulous.
Thank you, Pauline. And you are seeing there are certain key points, key screening points or key screening test, which is a part of this green book, and that's very valuable and very valuable information for us as a pediatrician and also for veterinary child health nurse, and it is also an important tool for them to make a point when this child needs to be referred further. So if you are getting advice from your veterinary child health nurse that yes, your child is not doing right what is expected according to the green book, it does not mean that your child has significant problem. It means it needs a further evaluation. It needs a further check to be done that this is fine, normal for your particular child, and it may not be abnormal. But it's important to detect these things early and to act early. In case there is something, we can work on that to help your child. Malini, I would like to know, particularly as we are concentrating more on migrant populations and particularly from South Asian country, the culture, the tradition, the language we speak at our home is different. The tradition, the culture which we bring from our own country is different. The way we live back in India or in Pakistan, Bangladesh, Sudan, in the migrant populations is totally different. Certain things are expected normal in different culture, but it might not be normal in our culture in Australia here. So can you give us a psychological point of view that how this different culture, language, tradition can affect the development of the child in a more holistic way? Like when we talk about, not only talking about the physical development of the child or the language development of the child, I'm talking in more broader aspect of the social development of the child, the emotional development of the child. Over to you.
Thank you. That's a really relevant question and one that I think requires a lot of cross-cultural sensitivity. In terms of coming from a minority culture here, it can be very confronting for families to face a very broad culture outside the home where the language, the food, the traditions are so different to what might be practiced at home. So from a little child's perspective, they have to face two very different environments inside the home and outside the home. So from a very young age, children can find it very confronting the first time they go to childcare or kinder or step out of their home and see a very broader, different environment with a different language, which might be predominantly English outside as opposed to in the home, or different clothing and different food. So for them to feel confident, to feel more emotionally able to handle changes, it's really important to help them to integrate from a young age. So it's helpful to be aware of all the community programs for social integration and for social groups, such as what's available in your library. There could be some play groups, there could be different community programs. So from a young age, exposing children to English early in the home, to taking them out to different cultural programs, helping them to have a wide variety of food both at home and outside, can really help with children to navigate these different environments from a young age. It's really important to realize that our children will grow up in a very mainstream environment and their world is going to be Australia, wherever we may have come from. And so to help our children to feel confident and socially and emotionally able to adapt, it's really helpful to provide that support from as early on as possible.
Thank you, Melanie. Very, very valuable information you have given. And as we all know, when we are talking about child development, we're talking about not only the physical development, we're talking about emotional development, the social development. For that, we need an emotionally stable environment in the family. We need a good social exposure for that child. We need a exposure to the language what wider community speaks. So it is very important to give this exposure to your child. If you speak a different language at home, it is very important to expose your child to the English. Whether that can be given by sending your child to childcare or kinder, depending upon what age your child is. But if you find it too financially challenging, because I can understand sending to childcare is expensive, then there are cheaper options available. Going to the playgroup, library, community center, these are other places where your child can mingle with other children of similar age and can have a more social exposure, have a more exposure to the English. Having an emotionally stable environment for that child is also important. If emotionally stable environment is not given, it significantly impacts the development of the child and of course can have a long-term impact. Like parental own fight is a one example in front of the child, can impact quite negatively on a child's mental stability. So it's a very, very important for the emotional, psychological, social development of the child, we need to provide the child a very stable environment from all perspectives, and that's what we call it the holistic approach. So dear friends, here I will take a small break. We will be back soon. Please stay tuned. Thank you. Welcome back, and we are watching Health Awareness Campaign. My name is Raj Kilan. I'm your host, and here we have a team of specialists who is working with child development. So we will continue our discussion further. Jody, I would like to know something about which really always bother me. Whenever I go to pharmacy, chemist, the whole stock is stacked with multivitamins, and we do see multiple ads on TV about multivitamins, minerals, inner health, and so many vitamins available over the counter, and parents are directly or indirectly sometimes forced because of this false media to buy and give it to the child, and they get also forced because they think, oh, my child is not eating well, fussy eater, so let me give some vitamins, let some minerals, at least I'm giving something. So is it really worth? And does it make any difference to the child?
Yeah, sure. So great question. And you're absolutely right. The vitamin and minerals section of pharmacies is ever expanding. And I think a lot of people are starting to turn to supplements because they are worried that their child is not receiving enough nutrition from their diet, particularly if they are a fussy eater. However, what the evidence suggests is that these vitamin and mineral supplements unfortunately don't provide any extra benefit in the child's diet. As long as the child is eating, most of their food, plenty of vegetables and fruits and lean meats, and if they're tracking along the growth charts the way they should be, then generally a vitamin or mineral supplement isn't required. There are some instances, clinical circumstances where children will need supplements, but this is something that would be identified by a GP or a paediatrician.
I think it's a very right and a correct information you have given. The supplementation of vitamins in a child who is eating a balanced diet. I'm using the term balanced diet. These supplementations are not needed. If your child is growing on a growth curve well, supplementation is particularly not going to help more. It's not going to make your child strong or a bodybuilder. So these supplementation of vitamins and minerals only needed if your child is deficient. And as Jody mentioned, there is certain medical conditions when it can be useful. If your child has some abdominal or certain problems where the vitamins and minerals are not absorbed well, like one of the very common problem I would like to mention is the celiac disease. Yes, it could be. Other condition which has already been previously discussed, if your child is taking plenty of milk, then definitely your child is going to be iron deficient. Particularly dark-skinned people, those who are not having a good sun exposure, vitamin D can be deficient. So these are the certain special conditions where supplementation might be useful, but in general, to increase appetite of your child, if you're using supplementation of vitamin, it's an absolute waste of money. As Judy said, we should avoid it as far as possible. That money can be better spent on child nutrition, on child's diet, and child's food. Dr. Malini, I'd just like to know from you, as a migrant or overseas parents, when you come over here, this country is new. There's a lot for us to know, to learn. And particularly, if there is nobody sick in the family, it's very unlikely we will have the knowledge of the health system, how it works in Australia, which is entirely different, totally different than what we be exposed to back in our country. So if, as we're talking in context with the child development, if child is diagnosed with developmental delay, suppose, how parents will know that there is so many facilities or health services available for the child to help, which probably not available back home in their own country. So would you give us a little bit of an idea from developmental point of view, what are the services available in Australian health system and how parents can navigate or approach to that services to help their children?
Thank you for asking. It's a very complex question, and I'll try my best to put it into some sort of a summary that's easy to understand, because it is not as simple as one particular service being able to offer everything to every child. So from a developmental disability or developmental needs or additional needs perspective, it's fairly important to look at health from the age of 0 to school going age, so 0 to say 4-year-old kinder, and then to maybe look at school going services. So from a very early perspective, services like Pauline service, like a good pediatrician, are really important to guide the process. Also a good GP who can point out any of the developmental difficulties, and once there is some understanding around what could be a challenge for a child, it's fairly important to try to target some early intervention. And so from an early intervention point of view, it's fairly important to look at services like early childhood intervention services that are currently available, therapy services through different models like Helping Children with Autism initiative, if your child has difficulties on the autism spectrum, or there are certain difficulties that you can get funding for under the Better Access system. So the funding generally tends to be the same, but it can qualify you for services like psychology services, occupational therapy, as well as speech therapy. These services are also supplemented by funding to childcares as well as to kinder services. So if your child needs any extra teaching support, it's often very difficult to have an additional needs child and an educator with a whole group of children. There is a facility for extra funding for 4-year-old kids called KISS funding, which is an inclusion funding support. So it can allow another teacher to come in or another helper to come in to help the whole group. Fairly important to understand that it is not a one-on-one therapy service. Early childhood intervention services are not aimed at one-on-one services. These are more key worker services where it is support for the whole family or the whole unit. Therapy services are offered more through the HAQUA model and the Better Access model. Another important thing to recognize is that the NDIS, which is the National Disability Insurance Scheme, which has already rolled out in the rest of the country and will be rolled out in our area, which is the Wyndham, Brimbank, Melton area in the west, will be rolled out next year by October 2018. And so those packages will then support the children who have developmental and additional needs. From an educational perspective, it's also important to see what sort of support children can get for educational purposes. And there are a number of options for schools to be involved in supporting children. If there is enough need identified through the assessment processes, an integration aid can be made available for a child or for a group of children. So these are funding options that have to be worked through with the schooling system. And depending on whether you go to a Catholic school, an independent school, or a public school, and the area you're in, there are lots of different variations in the funding models. This can be fairly complex, can be difficult, and can be at times anxiety provoking, and at worst quite frustrating for families and services involved. So it's fairly helpful and important to work with supportive professionals and to have an effort to understand some of these complex models, because it's very stressful when you feel your expectations are not being met for your child, and that may well be the case for a lot of complex situations. But if we work together, we can work towards creating the best possible solution within the constraints that we have.
Thank you, Malini. That was a very good wrap up of all the services available for parents you have talked about. Thank you very much. And have you seen, friends, diagnosis of developmental delay can be definitely challenging for the family. But as I said before, it's not the end of life. There are plenty of services available which we as a family, as a parent, might not be aware of. So it's very important to talk to your doctor, which could be GP or pediatrician or any other healthcare professional, and talk about the services available. Services are available for these children at each and every different age group. It could be available for the child care going kids, for the kinder going kids, and also for the school going children have their different level of funding. If the child cannot go to the normal school, there are specialized schools available. Like on the western side, we have a Western Autistic School in Levelton, in Nittry, and then we have a Warringah Park School. So there are number of facilities and services are available. And there are number of fundings available which can be availed. If you're not aware of, talking to your doctor, your healthcare professional would definitely be useful, but don't give your hope. As we are running out of time now, so I would like to ask you the final advice. What advice would you like to give it to our audience, our families, those who are visiting you, or those who sometimes miss their visits and they don't take it that is important part because they've never been exposed to Green Book like things back in their own country. So what advice would you like to give it to them?
Well, we'd like to see all of your families coming in for their key age and stage checks. We know that children who receive their key age and stage 10 checks over that period of their early years development do really well. Early intervention is really important. Early identification of any problem is just so important. It really does give far better outcomes the earlier we can actually identify that there might be some little problem, and it might only be something very minor that can be fixed very easily. But we know that early detection is really important for all families. So we'd encourage you to contact your local council, make an appointment, come and see the nurse. We would really love to meet all your families. Thank you.
Thank you, Pauline. So have you seen early detection, early advice is the most important key. So if you think your child is not doing up to the age what it should be doing, if the concerns are raised by the maternity child health nurse, see your doctor, get the advice early. Early advice, early action can bring the better outcome. So with this final note, I would like to close over here. Thank you very much for watching us, and we will bring next time another topic, and we will be with you soon. Thank you very much.
Thank you.